Hello, hello, hello. We are, just so you all know, we will be starting here in about a minute. Nice to see a lot of familiar faces, familiar names. Hey, Mark. Mark on the waterfront. We're seeing Collins ceiling, I think. How's everyone doing? I'm grateful for nicer weather and blue skies, even though I realize it helps me just pretend that that Oregon isn't burning, nor in a heat dome or in a heat disaster, at least for today. But it's really nice to see you all this evening. And thank you for spending part of Thursday evening with us. I'm Lisa Reynolds, State Representative, Oregon House District 36. Here's Christian Thompson of the famous Indivisible video series. Next to me, at least on my screen, is Maida, my Chief of Staff. I'm going to be really honest with you all. I know most of you here, we've been having some issues with trolls and Zoom bombers. I was at an event with Doreen on Tuesday, and bomber's too strong a word, but some people who were saying inappropriate things. And for that reason, today we are having our chat be that you can message me or Maida with a question as opposed to an open chat discussion. And I'm really, really sorry about that. That's not how I like to do things. But I'm a little concerned that some of the things that were said to me and about me you would all find really offensive. You would, I know you would. And so far I don't think it's anyone here, but anyone can register and join us today. So I apologize for that. You all know how to reach me. And again, feel free, if you type in the chat, it'll be to Maida and I, and we will go through those questions. So without further ado, I am going to turn this conversation over to Maida.
Thank you, Representative. Hi, everyone. It's nice to see you all again on a Thursday evening. Usually we like to start off our events with a land acknowledgement, so I'm going to do that right now. We are currently seated on the traditional land of the Yali Tualatin, the Wasco, Cowlitz, Clackamas, and Kalapuya. So as we know, Indigenous people have played a large role in shaping the world we live in today. So we want to make sure that we acknowledge them before getting started. And then I will just also reiterate what Representative Reynolds said. The chat is closed, but you can still message the representative or I with any questions. And then also feel free once we get to the Q&A to raise your hand and put your question in the chat, and we'll call on you if you want to speak. And if not, we'll just read out your question. So with that being said, I'm going to turn it back over to Rep. Reynolds.
Great. Good evening. So, I think I have about 6 hours of content for tonight. So I hope you're prepared for a long evening. No, I'm kidding. I definitely want to touch on redistricting at some point. I am going to start with, I think, what's on all of our minds, unless I'm completely just living in the world of COVID because I'm a physician. But I did think it was worth doing a brief COVID update, and then I can certainly take some COVID questions. But as you all know, anyone who's reading the news, and everyone here reads the news, Oregon is in a really pretty terrible surge of COVID. And it is, I think we're calling it the fifth wave. I have, and my printer isn't working all that well, and I didn't make slides, but as you can see, we're up here, higher than we've been anywhere. We're one of 5 states where our current case count exceeds anything we saw, last winter or even in the spring. I was in a briefing today with OHSU physicians, and as you've all heard, we're exceeding our hospital capacity. We are set to surpass our hospital capacity by September 1st. This is statewide. So the good news is for us here in Multnomah County, that COVID is much worse down in Southern Oregon. And they showed maps of the regions of the state where they have far surpassed their hospital capacity. Jackson and Josephine counties in particular are shipping a lot of patients up here to Portland. And that's what's getting really scary, is we now can't accept some of those transfers, hospital transfers. I heard today that either Josephine or Jackson County, I can't remember which one, is going to order refrigerator trucks because their morgue is so full. I mean, it's really hard to really fathom. The thing that's equally hard to fathom is we know that the reason why COVID is so terrible in Jackson and Josephine counties is because they have a very low vaccination rate. And the people down there are dug in on what Doreen calls commitment bias. They've gone down this road of saying, I'm against the vaccine, and they will literally stay with that dialogue until the moment they're intubated. And of course, when they get sick, they show up at the hospital, they want full court press, and they do deserve that. But it's pretty, it's very upsetting. It's incredibly upsetting for the people who are working in the hospitals down there. It's very upsetting for my friends who work in the ICUs up here who are getting the transfers from Southern Oregon. This means if you get in a bad car crash, if you have the bad luck of being diagnosed with cancer in the next month, if you have a problem with your heart, you will not get the standard of care that you would have gotten at a different time. So I know this is all overly dramatic, but this is what the truth is right now. And it's really depressing, and this could have been avoided. So this could have been avoided had we had a higher vaccination rate across the country, to the point where maybe the Delta variant wouldn't have emerged. That would have been like a 90% vaccination rate by, say, the 4th of July, which was probably a very, very difficult goal to meet. But even still, if we had had a higher vaccination rate across the state, we would not be in the dire straits that we are right now. So long story short, get vaccinated if you haven't yet. The only way out of this is to increase our vaccination rates. It's not going to help in the next few weeks, the hospital is going up, and then it'll eventually start coming down because there won't be any people left who haven't gotten sick with COVID. If you guys know people who are vaccine hesitant or what we're calling vaccine curious, try to have, a really open-hearted conversation with them. Give them a gentle out to change their mind, because this is what we need to move forward. One thing I'm in the exam room with families all day long, and I have a lot of 12 to 17-year-olds who are eligible to be vaccinated. As a state, only about half of 12 to 17-year-olds have been vaccinated. Most of the families I see, the kids who are eligible have received their shot. And for the families who haven't, I'm having long conversations with them. I'm a little bit like, God, I'm running behind. But to me, I feel like this is the most important thing I can do. And for the most part, I'm able to make some headway, or at the very least, they leave strongly considering coming back, and I'm going to call them in a week and see how they're doing with that. If you need any help with this, in fact, there's some good resources on how to talk to people who are vaccine hesitant. We'll send those out with either a follow-up email, or we are doing a newsletter next week. Schools are obviously really important, and as a pediatrician, I'm really concerned about the kids. Again, I have these like really cheesy paper charts. Here's the the rate of the number of kids with COVID is also shooting up, way up higher than we've ever seen it. And that's really because of the Delta variant, and the kids are not even back in school yet. So I'm a little terrified with the case count that we'll see going up. Now, it is true that most kids who get COVID recover and do fine. However, a small percentage of kids get really sick and have to go to the ICU. A small percentage of kids develop what's called long COVID. About 10% of kids who get COVID develop long COVID, which means chronic symptoms that we know about in adults: brain fog, loss of sense of smell, some chest tightness. And then there's this complication of COVID that is exclusive to the pediatric population called multisystem inflammatory system syndrome in children, MISC. About 40 kids in COVID have had that. And that is the one, ICU doctors don't usually get nervous. Like, they're like, kid on an intubator, kid on a ventilator, I can handle that. What terrifies them is the MISC kids, because they often need to be on heart-lung bypass machines, and we don't have enough of those in the state. So again, this trope, which I hear on social media, that kids don't get sick from COVID is not true. The other thing is that the other trope I've been hearing is babies don't spread COVID or kids don't spread COVID. And the reality is there was just a study that babies and toddlers spread COVID at a higher rate than other kids. And it's really just because what I've always said to parents, they're touching their noses, their eye, they're spewing their mucus. As when I talked to Senator Denbrough about it, it's like, yeah, we always knew they were dirty little monsters. So babies with COVID can spread COVID and tend to do so at a higher rate than other kids just because of hygiene issues. So I hate to be doom or gloom, but this is like way beyond where we ever thought we'd be. We did all that work of shutting down our economy back in March of 2020 to flatten the curve. And now it just feels really hopeless. And I guess, and it's because of unvaccinated people. It is almost exclusively because of people who haven't been vaccinated. And at that point, I guess I can ask if anyone has any COVID questions or any upbeat comments after this dark treatise.
Representative, there was a few questions that I got.
Okay.
One person was asking if you have any insight as to when the vaccines will be available for children under the age of 12.
Great question. So the next chunk of kids that will be approved for vaccine will be 5 to 12-year-olds, and we're kind of guessing November-ish. I think that the pharmaceutical companies are planning on submitting all their data to the FDA by end of September, they're saying. And then it takes 1 to 2 months for that to be approved by the FDA. And I will tell you, there's a lot of pressure on the FDA to like move more quickly. It just feels like the risk benefit right now is like, believe me, I want everyone to be careful. I want us to be really safe. I want FDA approval, even emergency use authorization to really mean something. But I also, it's terrifying that we're starting the school year without little kids vaccinated. Kathy, Kathy, we can unmute Kathy. And then it looked like Martin Mendelson also had a question. There you go.
I was just wondering, I've seen it in a couple of places that for the Delta, they no longer recommend wearing the surgical masks. They think you should move up to the N95s or 95s or KN95. So I did get a box of 50 from Amazon.
Yeah.
But it does seem like with the extra virus load that the Delta has, that may not be that surprising.
Right. I mean, I think given the contagiousness, I tried to draw, it's so bad. You guys have a really lowbrow state representative. So basically, when we talk about contagiousness, right, we talk about if no one was vaccinated and no one was taking any measures, we talk about what's called R naught. So the contagiousness of wild type COVID, which is the COVID that hit the US in early 2020, is 2 to 3, which means the average sick person will get 2 to 3 more people sick, and then they each will get 2 to 3, right? So if you do 3 rounds of that, that's 27 people who are sick, right? If I infect 3 people, they each infect 3 people. But the R naught of Delta is 6 to 8. So if we're even conservative and say 6, you infect 6 people, they each infect 6 people, that gets to 200, something like 220 in 3 rounds. So almost a 10-fold increase in infectivity, and it's airborne, which just means it's kind of everywhere. So I think, Kathy, your point's well taken. What I tell people is if you have N95s, wear them. A cloth mask is way, way better than nothing. And N95 is probably a bit better than a cloth mask. A surgical mask is a little bit better than a cloth mask. And I think that's in part because we tend to put fresh ones on every day when we're using those disposable surgical masks. So, and my patients all ask me, what should I put on my kids? I'm like, a lot of kids hate those N95s, and they'll just keep pulling them off. So it's whatever mask your kid will keep on most readily. So, but yeah, the more, the harder it is to breathe in and out of, the better it's filtering, is what I always like to say. Great. And then Maida's going to read out a few more questions.
Yes. So we had two people asking about the booster shots. I guess one, a comment in that they believe that the vaccine scheduling process is much better, and if you have any comments on that. And then also, when do you think that Multnomah County will start administering the booster shots or deciding who's eligible?
So right now, I mean, I think you can get a booster shot now if you're eligible, meaning you are immunocompromised, which means you've had a, solid organ transplant. If you're on immunocompromising medications, which goes along with organ transplant, and if you're on chronic steroids, and if you have a primary immunodeficiency, for example, HIV. So those are already being administered. And I think what I understand is you can go to, Costco or Walgreens and get those boosters. I don't know how strict they're being in checking if you truly meet criteria. When we, John's saying no, when we move to booster shots for all, and kind of the rule of thumb is 8 months after your second dose, I think it is, or did he say first dose? I can't remember. Second dose, thanks. I love all the fact checkers here. Is it second dose, John, or first dose? 8 months after second dose. Okay. That's probably the time when we think the antibody response might be waning. Now, remember, this vaccine's only been in use for like less than a year. So this is all conjecture. It's all being extra safe, I think, to do a booster. I think that's fine. I know there's some ethical issues because there are people around the country who haven't been vaccinated, but we got to keep our own people as safe as possible. That rollout will be similar to how the priorities were before, which is healthcare workers and nursing home workers, and probably nursing home patients will be priority. Older people will be priority. Hopefully, I mean, the big issue with why it was so difficult to schedule is the number of vaccines we had was so limited compared to the demand. As you may know, right now, we have a lot of vaccine here in Oregon. So I'm hopeful that the next time around will go more smoothly. I can't make any promises because the whole country is going to be vaccinating. So there could be a shortage at that point as well. Obviously, everyone's ramping up manufacturing and supplies. So I'm hoping that goes more smoothly. And I think the booster is important, but I think for sure the booster will be important, but I think the every single day matters doesn't have the same import when we're talking about a booster than that first dose of vaccine.
And then the other question that we had, what is kind of the status is PCC mandating vaccines, and do you see Portland Public Schools mandating vaccines for students?
Such great questions. It's like you guys are living in my email box. So tonight there's actually a special hearing on Portland Community College thinking about requiring vaccines for winter quarter. So Portland Community College's autumn quarter is mostly remote. There are some in-person classes that are kind of lab-based and hands-on based. And because the number of people who are going to be on campus is pretty small, they feel comfortable that they can make sure everyone's masked and socially distanced. They said their numbers show that 82% of people who will be on campus is already vaccinated. That's an extrapolation from, the number of people who returned a survey, which I think is a little bit of selection bias, but I'm pretty sure they'll be requiring it for winter quarter. And I would really love for it to be for autumn quarter, but I think that's about the best we're going to do. And I think, again, given that fall quarter is mostly remote, it's an appropriate kind of compromise, and it gives PCC time to, offer opportunities for students to get vaccinated on campus or to have the discussions they need to have to feel comfortable about getting vaccinated. And then Portland Public Schools. I will tell you there is a groundswell of discussion about requiring COVID vaccine for students. And especially when I think about the fact that the 12 to 17-year-olds are not really vaccinated as high a rate as we would like, and that these are the kids who are getting sickest from COVID, I would love to require it for high schools. I think it's going to be tricky to do that before we have full FDA approval, which should be coming within the month. And my understanding, and I will let you know if I'm wrong about this, is that FDA approval of the vaccine, even if it doesn't necessarily approve fully for the 12 to 17-year-old, as long as the vaccine is approved, it is completely appropriate to require it of younger kids if they have emergency use authorization for that age group. So there's a groundswell of support for this, and we are definitely looking into this. You saw Multnomah County required indoor masks. Governor Brown announced it for the whole state. Portland Public Schools required vaccines for teachers and staff. Then Governor Brown, extends that to the whole state. It is important to get a local big entity to take the first step. That seems to give the governor a little push to do it statewide, which is really what we need. John Calhoun, let me see how here, I'm going to ask you to unmute, John.
Yeah, just a fact check. In Multnomah County, 12 to 17-year-olds are like 68% vaccinated. So
thank you for that. Yeah, okay. I think I was giving you the statewide.
More than 2/3, and it's going up at a pretty steady clip. So it'll be over 70 by the time school opens. It is not, we're dealing with a minority of the student population.
Thank you so much for that distinction. Thanks, John. It's always good to have John here. Keeps me honest. No, I really appreciate that. Thank you.
And then somewhat related as well to the vaccines. So have you heard anything about PSU moving away from requiring all faculty and staff to be present on term for fall term? And then workers, sorry, this is Rob. I don't know if you want to expand on your question.
Hey, Rob, I'll ask you you can unmute Rob if you want.
Oh no, Mike, it's not working.
It looks like he's gone.
Yeah.
I don't think I kicked him out, did I? I asked him to unmute. Well, wait, oh no, he's up here. Oh, Rob, are you here? You moved to the top of the queue, that's what it is.
Oh, I think his mic is not working.
Okay.
So I guess, have you heard anything about PSU moving?
I haven't. So Rob, if you know anything on that, feel free to type that in the chat for Maida. I haven't heard anything about PSU rethinking their fall plans.
Great. And then I think our last question is about the vaccine data. So or does the legislature office have any numbers on the groups of people who have yet to be vaccinated?
Yeah. Hold on. So we know, well, I guess I know a lot more about Multnomah County, but these numbers are all in very hard to discern charts on the OHA website. But there is a 20-point gap in Multnomah County between white people and people of color. So we are not, even in our very progressive county with leaders who understand equity issues, we are seeing that we're still doing a poor job of vaccinating communities of color. And we need to do better. It's interesting. I was talking to someone today about the fact that a lot of community-based organizations, we call them CBOs, have gotten a lot of money to try to improve vaccination rates in their communities, but these aren't healthcare entities always. And there is some nuance and an art to persuading someone to get vaccinated. And I'm not saying I'm an expert on it, but I've heard all the arguments and I kind of have a spiel I do with people. And is there better support that we can give to community-based organizations besides money, which is kind of the easy part, to really help them come up with ways to persuade people who are suspicious to get vaccinated? And that remains to be seen. And I will say that as much as I understand that mandates can hurt communities of color, because, for example, the PCC argument is if you say you need a vaccine to come on campus then we may lose people who don't want to get vaccinated. And to that, I say, these people have to get vaccinated. We are the people at PCC. PCC is in the best spot to be the influencer on that. Mandates work for that reason. Although I certainly think we can do it in a way that's culturally sensitive and does it in a way that feels sensitive. But by telling people of color you don't have to get vaccinated, it's just playing into the trope that it's not as important as it needs to be. Damien, I'm going to unmute you.
How many unmute buttons can I hit? Yeah, you can hear me. Yeah, so that was my question. I guess, so I've heard anecdotally, because I don't know if these numbers exist, if, you know, some folks not getting it simply because they don't think they can take like the time off to go get it, and necessarily not, I mean, the shot itself doesn't take any time, but you know, the adverse effects after the second shot are pretty common, knocking people out for a day or two, and you know, some folks simply can't afford that.
Right. No, I okay, sorry, go ahead.
Well, I was just wondering if we had numbers where if that sort of group made a significant enough portion, and what legislator, either at the state level, or I doubt anything like this is going to happen at the national level, but you know, could provide this kind of support of like, we'll pay you for 2 days off so you can go get the vaccine kind of thing.
Yeah, I mean, I do know some employers are doing that, and certainly healthcare employers are definitely working with staff. Even, you know, early on we were staggering who got what vaccine when, because we couldn't have 4 people out in one day. And that is, I mean, that is the right thing to do. I don't know how much we can legislate that, but certainly I feel like if we came across that as an issue for a particular worker, could we intervene on their behalf and really make that happen? But definitely. Rob Fulmer, who I think we weren't able to hear him, he was Rob Fulmer is at Portland State University. And so I think what Rob is implying is that Portland State isn't requiring vaccines for the fall. I thought they were. And if Portland State isn't requiring vaccines for the fall, they certainly need to. But I'm pretty sure they are. Does anyone know? John Calhoun? Oh, okay. So they are requiring vaccine, but it sounds like there's a lot of loopholes in there. So I would just say that is up to the university to close loopholes. You know, right now there are very few medical reasons to not get a vaccine. Like, I can't even think of one, to be perfectly honest. Wait, John has one. I'm going to unmute you. Yes, John.
Our future state senator has a condition that does not allow her to be vaccinated.
Okay, I stand corrected. Okay, good to know. One thing that we get into a lot with pediatrics is non-medical exemptions. People may call it religious or philosophical. I would just say, do remote learning. I really think if your religion prevents you from being vaccinated, we may have to ask you to do remote learning. This is our house is on fire. And I shouldn't use that analogy because that's true too. But I think this is time for tough times. There's a long thing from Jeff that maybe Maida can read. Martin, I'm going to ask you to where are you, Martin? Here. Okay, look, you should be able to unmute now, Martin.
Got it.
Yes, I know it's complicated. Yes.
No, it's not at all complicated. Thank you very much. I too am a physician. I'm a family physician and have been for 45 years or so. And from my point of view, what's necessary, what is missing right now with the third dose business is the inclusion of the elderly. The elderly are by definition immunocompromised. And I think that they should be explicitly added to the immunocompromised group that are going to get third doses in less than 8 months.
I think that's a fair thing. I think, I'll be really honest that our state has traditionally not gone beyond what the CDC recommends.
Well, I don't see why we can't.
I know. I believe me. We've gone back and forth on this on several issues over this past year, but that currently is the party line.
Well, I guess we're stuck with the FDA's inability so far to fully approve with these vaccines, but emergency approval is certainly enough, and I don't see why we can't go on with that.
Yeah. No, I think your point's well taken. I really appreciate that. Okay, so I am going to move on. Jeff Kidder did send me something, and I'll just say Portland states, thank you, Jeff, requires all students who learn, work, and engage at Portland State to submit, proof of vaccine, or if you're, or that you're not going to be on campus, or submit for an exemption. So I guess my hope would be in hearing what Rob Fulmer's concerns are, is that the allowance of exemption should be pretty few. And also we need to keep masking, of course. So of course, and then what I haven't said, and that we all know, is that unfortunately early on, it seemed, I found some old things I wrote as far back as July, that vaccinated people cannot get nor can they transmit COVID. And I think we all knew that, like, you could maybe get COVID if you were vaccinated, but like you could probably never spread it. Well, all of that is false with the Delta variant. Although I will say, and I want to be really clear, you are still at a huge, huge, huge protected state by being vaccinated. I think 1.6% of vaccinated Oregonians came down with COVID in the month of July versus like 7% of unvaccinated. Those who are vaccinated are much less likely to be hospitalized, much less likely to have to go to the ICU, and much less likely to die, although we have had breakthrough infections lead to death in Oregon. And lastly, although you are contagious when you have a breakthrough case of COVID, the contagious period is felt to be just 2 days versus like 5 to 6 days. And it all has to do with mucosal loads. So I'm going to move on and just talk about a few other things I've been doing besides living, eating, and breathing COVID. Not literally breathing COVID, but so the session ended now, 6 weeks ago. Since then, we've had 3 major heat waves, which have been dangerous. From what I can tell, it was only that first one that led to substantial deaths, over 100 deaths in Oregon, most concentrated in Multnomah County, most concentrated in East County, most concentrated in people who live alone without air conditioning. So it's clear what we need to do to protect people from the new normal of heat dome. I had the opportunity, I did volunteer for a little while, for about 3 hours at a cooling center last week for homeless people in the Portland building. It's really interesting because the building is otherwise empty because of COVID, but the whole lobby was turned over to being a temporary shelter for homeless people, where people were fed, where people had water. Several of the homeless people brought their cats in little carriers, which was kind of sweet. I have to admit, when I was there, I'm like, we should be giving COVID vaccines. I mean, not in any sort of, quid pro quo way, but I just felt that would have been a good opportunity to give COVID vaccines, but met a lot of really nice people and enjoyed that work, and that people were very grateful. That ended up being a pretty bad heat wave, and the smoke really made it worse. But nothing compares to what happened in June with those 3 to 4 days of unrelenting heat, including over a weekend, including during a time when our 211 kind of social service system was not up and running sufficiently. I think that has been fixed so that when people are in need now during a heat wave, they can call 211 and get help getting to a cooling center or other things. John Kitzhaber, when he was governor, I think this was around 10 years ago, and he was an amazing healthcare innovator, and he would talk about the fact that we should have our health insurance. It doesn't kill you, mutates and tries again. That's true, Jeff. He would talk back then about we should have, like the Oregon Health Plan, pay for air conditioners, because for some people, especially people with health, underlying health problems, not having an air conditioner makes them a lot sicker. I will tell you that not a single air conditioner has been bought through Oregon Health Plan dollars, although Ron Wyden has certainly made this a federal priority. So, for the cost, I don't, a couple $100, I think we're going to need to start thinking about providing air conditioners, especially in those buildings where people are living alone. There's also a environmental price to running so many air conditioners, but right now, life and limb is what's really important. The other thing, so we're working on, I'm working with Representative Confam as well as city and county about how can we safeguard people from what happened in June. We know this is going to be a new normal for Oregon, and it is a little bit. I think the smoke emergencies play into this too, because obviously when it's smoky outside, you're limited on what you can do in terms of getting air from outside. The other things that we've been working on is we're doing work groups that are outgrowths of things that came up during the session. So I'm working on earned income tax credit issues for kids, which is a tax refund that has been linked to raising families out of poverty. Also working on issues around source water for drinking water, as well as a system for compassionate medical release for adults who are in custody. So those are work groups that I'm involved with. A couple other things that we're working on. I mean, I will just say, I just feel like I'm working on COVID all the time in terms of figuring out what we can further, basically what we can further mandate in terms of vaccines, and working with folks in the school system and in the governor's office on that. But we're also Zenith. I'm going to ask Maida if you can talk a little bit about what's going on with Zenith, if you wouldn't mind.
Sure. So essentially a few weeks ago, we had a couple of meetings with constituents who had expressed concerns about the Zenith oil terminal, which is in Northwest Portland. It's not in our district, it's in Representative Maxine Dexter's district, but obviously the repercussions of any type of Cascadia subduction zone event creating issues in the terminal would impact all of us in the city. So what we did was we reached out to county and state officials as well as advocates who have been trying to make sure that the land use compatibility statement permit that is currently being considered by the city of Portland for Zenith doesn't go through. Thankfully, there's been like an outpouring of support legislatively. So Representative Confam of House District 46, she released a statement on Monday in opposition to the Zenith Lux permit. And then we are working with her office to release a letter to the city as well tomorrow, actually, with a bunch of other state legislators and elected officials to express our opposition to. So we are hopeful that that will sway the city a little bit. And we've also heard that Multnomah County commissioners are expected to release a statement in opposition as well. And then we're going to kind of keep an eye on it and see how the permit process goes. But some positive improvements. So that's what we're happy about.
So you all know, I mean, you guys, when you drive out to like Scappoose along Highway 30, and I remember Sharon Myron saying, like, I always kind of looked over there and wondered what that was. Well, I mean, it's tons of outdated containers of petroleum products, and it's in the liquefaction zone, which means when there's a big earthquake, it's going to be really, really bad. Whether it's explosions or things leaking into the Willamette River. So there is a long process in shoring up some of those containers. And I think everyone's thinking is, why would we be adding more capacity for petroleum transport or petroleum storage in that area, which is what the Zenith project would be. So I'm glad on that. Speaking of Confam, and Rob is saying the oil trains are even more imminent threat. So I appreciate that, Rob. The trains that go through there carrying lots and lots of oil. I just, there's certain people you're just like, I'm just going to hitch my wagon to that person. Doreen is one of those. She's here somewhere. But Representative Confam has just been doing such interesting work. In this past week in particular, she was on the forefront with Senator Ron Wyden and Multnomah County Commissioner Jessica Vega Peterson talking about the hot zones in East Portland, which I referred to earlier. East Portland, because of its terrible tree cover, all the trees were raised and building those communities, as opposed to where I live in the west side of Portland. The degrees were measured by a Portland state scientist, 10 degrees hotter in East Portland than the west side. And so we need to be definitely growing more trees there. And so that's a priority, and green spaces and breaking up the concrete blocks with more green spaces. The other thing Con did was the Zenith, and she and I have kind of been working on that together. And then she also came out with Senator Casey Jama, really calling on the governor and the federal government to really open up our doors to refugees, specifically those who are fleeing Afghanistan right now, which is just almost too heartbreaking to bear. So those are all things that I've kind of hitched my wagon to 100% support, although it wasn't necessarily the spearhead on those. I do want to talk for a few minutes about a topic that you all may think could be a little boring, but I do think is important to bring to your attention, and that is redistricting. As you all probably know, every 10 years, we count everyone in the United States, the US Census, and it happens, on the 10 years, so we just did it in 2020. This, unfortunately, for the first time in a long time, this system became very politicized when Trump tried to prevent illegal immigrants from being counted for the first time ever. And while that was thwarted by the courts, I do think it led to a lot of suspicion among immigrant communities, and there is some concern that maybe those communities were undercounted. Be that as it may, the results for undocumented immigrants, I'm sorry, thank you. Appreciate that, very sorry. The numbers have come out. We heard in April that when we really looked at state by state numbers, that Oregon gained a seat in Congress. There's a finite number of seats in Congress, 435, and they get reshuffled depending on population. And my understanding is the last time Oregon got a new seat was 1980. And for the last 30 years, we kept thinking we were going to get a 6th seat. Well, it happened. So we now have a 6th seat. So that means that our current map of 5 seats, which I'm just going to show you here, has to be redrawn, right? We need to now divide it up into 6. And as you all can imagine, too, that's fraught with a lot of political gamesmanship on how those borders get drawn, because we who are Democrats would like to have more Democrats sent to Congress, and those of us who are Republicans would like to have more Republicans sent to Congress. So the balance of US Congress is really dependent on how these maps are drawn. That said, though, our process of drawing maps in Oregon is a bipartisan process done at the legislative level with a committee of the Oregon House and the Oregon Senate. The other districts that are going to get redrawn are the state House and state Senate districts. So this is where they are now, and this is color coded, you can't really tell, of which districts have lost people in their geographic boundary and which have gained. So House District 36 is up about 2,500 people, which isn't surprising. Maxine's district, which includes the Pearl district, is up like 8,000 or 9,000 people. So we want each district to be about 70,000 people, and that's House district. And then a Senate district, which takes up 2 House districts, would be 140,000 people. So there are several House and then Senate districts whose borders will be redrawn, probably including House District 36, because we have 2,500 people over that 70,000 target. So the process, I'm just going to go through the process really quickly. All the data was released, I think, yesterday or today, and there's a really cool website where you can sign up, make an account, and you can play around with the maps and the numbers and demographics, and you too can actually draw what you think would be a good map for Oregon to subscribe to for either U.S. congressional districts and or Oregon House and Senate districts. The way it works now is that the the committees made up of state legislators are working together to come up with some sample maps, which they will release, and then they're going to go on a listening tour. I think at this point that listening tour will be virtual. They were planning on circling the state, but I believe now because of COVID that it will be virtual. Even if they are circling the state, they're going to allow for virtual testimony, because we all certainly discovered that it's really important to allow people to testify from their home and not have to drive to Salem. So the schedule of that, there's like 10 or 12 meetings that are somewhat region-based, where people can testify about what they think is important to them with redistricting, what their particular community needs are, and why you want that community to stay together in one district. What are you concerned about in terms of transportation hubs? Remember, especially at the US congressional level, these districts are tied with how much funding gets brought into the district. But certainly at the state level, we want the district to represent who lives in a particular area. And the way we draw these boundaries will influence who gets elected and what policies get passed. So we really authentically want a lot of input from people. I think, future Oregon policy really depends on how the final lines get drawn. So I'd love for you all to think about inputting, whether it's testifying through Zoom, actually it's Teams, or writing up written testimony, or thinking about what's really important to you about this process. And then there will be ample opportunity to make your voice heard. You can even submit maps, which is pretty amazing to me. So the way that works is those meetings will be between September 8th and the 13th. And then the committee will regroup, incorporate what they learned in that road trip, come up with another set of maps, and then we will be heading into a special session at the Oregon Legislature on September 20th. And at that point, we'll vote on those maps. And if they pass, great. If they don't pass, then it goes to the Secretary of State for House and Senate, Oregon House and Senate, or to a panel of judges for the US congressional map. So it's a little bit wonky, it's a little bit technical, but it can really have an impact on what happens in Oregon for the next decade. So I urge you all to think about it, read about it. I will be sending out a newsletter next week that incorporates a lot of this information, as well as how to get involved. Does anyone have any questions about that? Great. Boy, the COVID really brought up a lot more questions, huh? Anything that, Martin. Yes, sir.
Okay. Having House districts boundaries redrawn by politicians, even good politicians, is fraught with problems. Why have we not gotten to an independent commission to do redistricting, as a few other states have done?
Good question. I will plead a little bit of ignorance because I'm new to the process, but I will be really honest. The parties that are in power, when a party's in power, they don't have a strong incentive to change the system. And I do think that there is a growing realization and support for an independent committee to do this. I will say that the Secretary of State is bringing together a People's Committee, should it come to her desktop, that she has to draw the lines. And I think right now we're just not there yet.
Well, I am a member of the party in power. I'm a Democratic PCP here in Multnomah County. Nonetheless, I think that we're in power now, but what's going to happen? What is going to happen in all these states where the Republicans are in power? And what's going to happen when, God forbid, Oregon is no longer in the control of the Democratic Party?
You are 100% right. I couldn't agree more. I agree. It's hubris, right? It's hubris thinking we're in power. We'll always be in power. Let's keep the system this way. Absolutely. Absolutely. Right. Yes, Kathy.
Thank you.
Thank you.
Okay. We actually tried to do the commission and we got caught by COVID. The signature gathering started right at the beginning of COVID. We didn't get the signatures that were required. They went to the federal court and actually got permission to get fewer. And it was appealed to the, originally it wasn't going to be appealed to the court, but the Attorney General decided to appeal it. And of course it took too long. And so it couldn't get on the ballot. But the people, Chris Kobe, who would usually be here, but I think he may still be on vacation. Their plan is to do the, people, not politicians campaign again, there's no advantage to doing it for 2022. So it may be for 2024.
Yeah, I mean, I would argue we probably should do it sooner rather than later, with the thought that it takes time to get that process up and running. I've come to appreciate
you're not going to get anything done before 2030.
No, I know, but boy, I've come to appreciate sometimes how slowly the gears of government work. You didn't hear that from me. Okay, Bill.
My question, I think I've written in the chat. I will state it, however.
Thank you.
At this point, Representative Reynolds, do you have some suggestions you believe would be a good idea of portions of your district that you'd like to eliminate, like to share, like to push off to somebody else?
No, I love you all equally. No, I mean, one thing I will just say is that there's been some discussion that maybe all of downtown Portland should be one legislator. So I have like downtown south of Burnside and I have Old Town. But the Pearl District is in Maxine's district, as you can imagine. That's the one that's grown so much. So I just don't know. I don't have a strong feeling. I will say that I've come to spend a lot of time and gotten to know a lot of people in Old Town in terms of the social services that are there. And I would really love to stay the state representative for Old Town in addition to downtown, but I just don't know. Sometimes I think it might make sense to just lop it off at Burnside, but I really don't know how this process works. And there's no part of the district I want to get rid of. And I'm not just saying that. I just think it's a really great, really interesting district. But I realize I'm going to have to get rid of 2,500 people. Who's going to volunteer? But thanks. That's a really interesting question, Bill. And I really don't have a good, feeling for how they make those decisions. Well, I just want to thank you all for being here tonight. I want to announce that on Thursday, September 30th, from 6 to 7 p.m., we're going to do an event with, it'll be after the redistricting process. We'll be doing an event with Senator Ginny Burdick. It'll be probably her last month in office, and State Rep Dacia Graber. Unless she's out fighting fires. I mean, Dacia is like working double time, doing local fires because a lot of people have been sent off to the wildfires. But our initial plan was to have it in person. Right now we're rethinking that. A lot can change in a month. Hopefully a lot changes for the better so we can still have an in-person event. So stay tuned on that. I'll be doing another town hall in September. It might make sense. I haven't figured that out yet. I'll let you know. I know that we may do it right before the redistricting. I have been meeting with a lot of constituents, including several of you here, meeting one-on-one. We were meeting in coffee shops. We're going back to doing it virtual. I'm happy to meet with any of you all at any time. But like I said, I think we're going to switch over to virtual. Especially since by nature, by being a pediatrician, I'm around unvaccinated people all the time. We're all wearing masks. I'm very careful. I have all the gear, but I certainly would not want to get anyone sick. So if anyone has any interest in meeting with me one-on-one, I've really been enjoying having the time to do that this summer. And without further ado, Maida, anything else? I'm sure there's like so much more I could have talked about. I could talk more about the Delta variant and how it multiplies in the nasal mucosa, but I won't.
I think that's all the questions that we had. We do have some separate follow-up to do with constituents, but we will include all the information that the representative spoke about in our follow-up email tomorrow, including how to make your own redistricting map. So that's
Yes, I know. You could really nerd out, just saying. Really grateful for all of you for spending part of your Thursday evening with us. Stay well, reach out for anything, and I hope to see you soon, I guess. I guess we can't really say that. Look at Jeff Kidder, that crazy picture back in the early days. That's so